Okay. We're going to go ahead and we're going to do the shoulders, the upper extremities. Right now, I'm going to take a look to assess for any nodules. I'm looking for symmetry. I'm looking for any muscle atrophy. Anything that doesn't look normal. Any swelling, any deformities. And from the anterior perspective, everything looks good. Can you turn around for me? Same thing. I'm checking for the back. Anything posterior that may look abnormal. Again, looking for symmetry. I'm looking for any abnormalities, swelling, deformities, and everything looks good. I'm going to go ahead and have you remain standing. So I'm going to have you go ahead and turn forward for me. Okay, good. So what I want you to do right now is I want you to go ahead and we're going to do some abduction. So with your arms at your side, I'm going to go ahead and have you take your arms, both of your arms at the same time, is fine, away from your body, up in the air like so. Perfect. And then can you leave it up there for me? And can you take the right arm and cross it over to the left? Perfect. And I'm going to have you do the same thing. Perfect. So we've done abduction, and that last move was adduction, moving towards the body. The next thing I'm going to have you do, can you please take your hands and place them behind the small of your back? Perfect. That's me checking for internal rotation. No pain or anything with any of the movement so far? No. Good. The next thing I'm going to have you do is I'm going to have you, this is checking for external rotation. I want you to take your hands and put them behind your neck like this. Kind of act like you're scratching like the back of your neck. That's checking for external rotation. Any pain or tenderness with that area at all? No. Okay, perfect. Now, I'm looking at the fluid of his movements. Was everything symmetrical? How the muscles and the bones moved and everything moved great. I didn't see any issues or problems, anything I could visually see. He has no complaints of pain or swelling. So I made sure that I assessed that. The next thing I want you to do is I'm going to look at your the scapular motion. So I'm going to have you take both of your arms and move them up like this, up to the side of your head. Perfect. Assessing the scapula. We go ahead and have you looking at from the front. You're going to put it down. Looking at the deltoid part. Turn around for me. Do the same thing up, please. Hands up. Looking at the scapula and how that perfect. And let me go ahead and have you move your hands down. Scapula looks great in terms of the movement. The other thing I'm going to have you do right now is I want you to flex your shoulder for me forward to 180 degrees. So what you're going to do is, again, I'm going to have you go out this way like this, all the way up. Okay, and then now what I'm going to have you do is I'm going to have you go all the way and kind of put both of your arms behind, back as far as you can take. Perfect. You can stop right there. Okay, now turn around. I'm going to also just assess from the back. Do it for me one more time so I can also look at the scapula all the way up to the top. There you go. Oh, be careful. Sorry. Watch your hand. And all the way down and kind of back. Perfect. 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 Okay. Now what I'm going to do is I'm going to be assessing for tenderness. I'm going to be assessing for fluid. You could have a seat for me. Make it easier to kind of see inside the camera here. Okay. So we'll go ahead and we can start. Hopefully, yeah, we can see. Okay. We're going to go ahead and we're going to start in here, just palpating. Okay. I'm going to make my way into the acroclavicular joint. Okay. Then we're going to come down here into the scaphoid process. We have the coracoid process. Our lesser and greater tubercle. Any pain or anything with anything I'm doing? No. Okay. Bicep groove. Any pain or discomfort at all? Okay. So, and I will do the same on both sides again, just checking for the acromioclavicular joint, the coracoid process, the lesser and greater tubercle, as well as the bicep groove, which you saw me all do on this right side, and I would do the same thing for the other side to ensure that they were both done bilaterally. No pain. Okay, perfect. Now there's a couple of specialty tests for the shoulder area. The first being the Hawkins impingement test. What I'm going to have you do is the patient would lift their arm up this way, kind of slightly abducted. I press in on the shoulder. Do you have any pain or anything like that? No. Okay. What that would do, if there was any type of positive or there was any kind of pain, that would be indicative of like a tendinosis. So that's a test that you can do for the shoulder in terms of checking for just, you know, shoulder problems or shoulder issues. The next thing is going to be the head and the neck. So for the head and the neck, again, what I would do is I would assess to see, can you face me? Again, I'm looking for any kind of deformities. I'm going to have you stand if you can, please. I just want to check posture. Turn around for me. Even from the back, neck looks good, posture looks good. I'm going to look even this sideways. I'll look again when we get to the actual spine portion for me, which is part of the lower extremity that I put the spinal portion in, but I'm still again looking at the neck from a side lateral view. I'm going to have you come back to me this way, face that way again. Okay, everything looks symmetrical. There's nothing of any concern to me. I'm going to go ahead. There's no abnormalities. Posture's not abnormal. So let me go ahead and have you have a seat here just to make it easier for the camera to be able to see. The first thing we're going to do is extension. So can I have you touch your chin to your chest? Perfect. The next thing I'm going to have you do is I want you to be able to touch your chin to each shoulder. So we're rotating. There we go, to the other side. Perfect. The next thing is, can you touch, I'm looking for what they call lateral bending. Lateral bending. So can you go ahead and you take your ear to touch your shoulder? Okay. And then the next thing I want you to do is I'm assessing how well you're the maximum amount that you can open your mouth. So can you open your mouth for me and close it? Perfect. And then also now I want you to move your jaw with your mouth open. Kind of move your, perfect. Now what I'm checking right now, I'm going to go ahead and get into the palpation portion. I want to check for TMJ. So what I'm going to do is I'm going to press in this area here. Can you open and close your mouth? Close it. I'm feeling to see if I feel any clicking, any popping. Did you have any pain or anything like that when I did that? That's checking for TMJ. The other thing I'm going to do is if you can please stand up for me one more time and turn this way. I'm going to stand up with you. We're going to go ahead and we are going to, again, just make sure that I'm looking at the cervical spine. Okay. I'm palpating on the paracervical muscles. Checking all the vertebrae. Do you have any pain or tenderness with anything it is that I'm doing? Sacroiliac area, which are like the butt dimples. Okay. Rhomboid. Got trap muscles. Any pain or tenderness with anything? No. Okay, good. You can go ahead and have a seat for me. The last thing that we're going to do is going to be a specialty test. It's called the cervical compression test. It's just to check for cervical radicular pain. So what would happen is I would have the patient extend their neck. Actually, I'm going to have you turn this way. Extend it some, and then I would actually put some pressure down. If the patient has any type of a pain that the patient feels after applying that pressure, then that's a positive test for